Hi, and welcome to Happy Hour, Happy Patients. We are a healthcare innovation podcast that highlights ideas, trends, and innovations happening all around us in the healthcare system. And I'm your host, Lisa Blue. Today, we're privileged to have a distinguished guest, Dr. Chet Robson. Dr. Robson is an accomplished physician and a pioneer in the realm of healthcare technology. Our show, Happy Hour, Happy Patients, references the concept that focusing on our own health and happiness has a direct positive impact on the patients we serve. We created this space to talk with our extraordinary guest, and hopefully these conversations inspire and re-energize you while sharing the exciting how-tos that you can take with you to make your next workday and patient interaction a little bit better. We all know that change happens incrementally, so sharing these ideas can move us all towards improvement together. Now, let me introduce Dr. Robson. He has an impressive background that spans medical practice, clinical leadership, and digital health intelligence, and has dedicated his career to making a positive impact on the world of healthcare. His journey is a fascinating one, from his early studies in music performance and education to pursuing a career in medicine. His educational background and wealth of experience have uniquely positioned him to drive innovation and transformation in the healthcare industry. As the former chief clinical officer at Walgreens, he played a pivotal role in the global pandemic response. Today, he continues his remarkable journey as the chief medical officer at Disrupt, an advisory firm that focuses on connecting healthcare organizations with emerging technologies to drive innovation in the healthcare industry. His insights and experiences are invaluable, and we're excited to explore his journey and vision in our conversation today. Welcome, Dr. Robson.
Thank you, Lisa. It's a very generous introduction. I appreciate that.
Well, I'm excited about our conversation. I know I certainly gave some background into your professional background, but can you start us off with something that you would like the listeners to know about you that might be personal or professional?
Perhaps, beyond clinical things, I'm also quite involved with the American Heart Association. That's been a movement that's really important to me for a whole number of reasons. And then secondly, perhaps more importantly, is that I'm also a grandfather and have really just a wonderful time with my granddaughter and enjoy that very much.
How wonderful. Thank you for sharing that. I'm so interested in hearing more about your current role as the Chief Medical Officer at Disrupt, and what is the vision of this work? If you could give us a little insight into what that looks like in your day-to-day and really that broader vision.
Yeah, thanks. Disrupt is a very dynamic, young but dynamic group that's growing, I think, quite well. So let me first give you a little bit of overview of what we do at Disrupt. It's a company that connects. It has two kind of primary objectives. The first is what we call experts on demand. So it's taking experienced healthcare professionals that bring their expertise and their experience and their professionalism. Then we connect them to companies, primarily digital health companies, that have the technology and the mission of the organization, but they don't necessarily have some of the clinical experience. And we think that by helping to put those two together, that then it helps to take some of that expertise and then help the digital company to develop, even better products. The second thing that we're working on is building a database of digital health companies, but the digital database is a little bit different than some of the others out there. It's particularly focused on the evidence that they have generated, on the clinical outcomes that they can demonstrate, and on their medical leadership. And so being able to look at the actual outcomes of these companies and helping them to move to be able to demonstrate those outcomes is very, very important, especially in healthcare.
Absolutely. I think that repository or that database that really houses all of those validated, right, tools, right? That's part of the work that you guys are doing. It sounds like is doing some of that validation to say this is really a tool that is driving outcomes and is something that could, if applied similarly, could potentially drive outcomes for you. And certainly that helps, I think, thin some of the, there's a lot of different tools out there. And so, really being able to have some validation, at least maybe start 5 steps down the road in that process when evaluating a tool. So I think that's a really valuable service. So maybe tell us a little bit more about if an organization they have a tool or they have a proven methodology that they're really excited about and they're getting those outcomes. How would they interact with your team at MDisrupt? How would they become part of that trusted resource database?
Sure. So that's a great question. I'm glad you asked that. So on our website, one of the things our engineering team has just done a tremendous job over this last several months is we actually make it so like a company or an individual can go on the website. If they're a healthcare professional, they can go and just sign up for free and put their name into the database. They'll be evaluated if they meet the criteria that MDisrupt is looking for. Gives them the opportunity to fill out that information and then become part of the expert network. On the client side, same type of process. The client can go into our website, mdisrupt.com. They can put in information about what types of experts or what type of problem they're looking to solve, what kind of support they need. And then what that will do is it will help to present some potential solutions for them. And of course, then it connects us, to our business development department. Then that will drill down much more specifically about what they're looking for, what kind of program makes the most sense for them, so that they get the very best type of expert, or in sometimes panel of experts, to be able to help either for just a specific project, to be an ongoing advisory board, perhaps be a round table where they can pull ideas out of. So there's a number of different solutions that they can utilize the experts for to help, depending upon what stage of development or what types of projects any company is working on.
It's a really well thought out plan to bring the sharpest aspects of all of those different parts of the field, from the technology and the innovation and the entrepreneurs to those that have been doing the work and are doing the work, that are closest to that and really understand what those problems to solve are. I think back in my own program when I completed in grad school, and there was a healthcare technology program that I later went back and taught, which was really a lot of fun. The first part of that was really not coming up with an idea. It was, really drilling down into what is the problem to solve, and being very clear on that problem statement, and then working for the solution. So I think that's really an important piece. And it sounds like that is really at the root of the work that you guys are doing.
Yeah, I'm really glad you brought that up, because that quite often that is exactly some of the really important initial work that we do. Is it's sometimes just really defining clearly what is the problem you're trying to solve, or sometimes for some of the companies, even your company, what is the problem it's trying to solve? Because sometimes what happens is that companies develop really cool technology and then they go out and look for a problem to solve with it, rather than saying, what is the problem I'm trying to solve and how can I utilize this technology in the best way to do that? So I love that you mentioned the importance of really establishing what that initial question is, because so many times we find that is exactly the starting point that we have to begin.
I couldn't agree more. The company that I work for, that's really part of our process. Our founder talks about, it's a row one, right? What is that MVP? What are we trying to solve? And the technology is ultimately part of what is going to help us scale that. But how do we solve for that? And how do we really think through that process? So I'm glad to hear that you guys are, that's part of your evaluation process. And maybe even if someone has a really cool technology, maybe sending them back to think about what is the problem to solve. So throughout your career, you've emphasized trust, credibility, patient-centric care across these roles. Can you elaborate on the importance of those types of principles when when there's that the crossover into healthcare technology, and maybe share some examples of how you've seen that in your work through the years?
Sure. I really appreciate you asking that, because for me personally, this is central to what I believe in and what I do. And let me kind of frame this for you a little bit first. The challenge with healthcare is that other than trauma, healthcare generally starts at home. You notice a symptom, there's a cough, a pain, a bump, an ache, or whatever it might be, and you immediately have to determine at home by yourself, right? What's the severity? What should I do next? How bad is it? Where should I go? Right? And so you tend to use your own knowledge, experience. You compare that with your friends and family and coworkers, and you Google it and begin your search. And especially if it's not only yourself, but a loved one. So you implicitly have to make the right decision, right? But there is never time to do this. This is always interrupting your regular life. So where can I go that I trust, that will take the least amount of time, cost the least amount, and resolve this symptom as soon as possible? The second category that we deal with all the time is, unfortunately, not things that we feel. These are the processes that happen in our bodies, like high cholesterol and cancer, and some of these kinds of things, autoimmune conditions, that many times become very severe and involved before they really ever present symptoms, right? For these types of conditions, by the time they present, right, this is going to require a major intervention. So in both of these scenarios, these are not things that we want. They interrupt our lives. So finding a trusted, credible source is paramount. Because you are entering a world of schedules, prices, and language, it is very confusing. Sometimes it's irritating, it's overwhelming. And for each patient, all of these elements we've mentioned varied. Each situation is unique and different, right? So as a healthcare practitioner, it's essential to be trusted, credible source that treats that individual patient's needs. But because every individual is different, some want to spend a lot of time discussing matters. Some are extremely time limited. Some want a lot of information. Some simply want to make the quickest solution, right? Others need to deliberate for a long time. All of these patient differences require different delivery solutions and create the need for a trusted, credible, patient-centered care, right? Also, so this is a never-ending quest that, because medical knowledge is constantly expanding, trying to stay up to date with what's actually improving healthcare and not just what seems to help is a constant effort, and then tailoring that to each individual patient so that that patient achieves the outcome they are looking for requires knowledge and, most importantly, relationships. So to me, trust, credibility, and patient-centeredness are the very core of providing meaningful healthcare.
Very well said. Certainly, the all of those important points. When this interrupts life, we think about health, but oftentimes in our country, we don't think about it until there's an interruption in said health, or right, there's something that comes up. Yeah. And so, being able to have that trusted source and that relationship certainly is of utmost importance. But I think some other variables, as if there weren't already enough in the answer you just presented. But, even just navigating the system itself, right? I always talk about that in my own life. I've been a nurse for over 25 years, and the healthcare system is still confusing to me for myself as a patient or my loved ones. And so when you think of patients that have any number of barriers to accessing that care, how that becomes infinitely more challenging. And so that's something that, we always try to think about. What is that immediate next step, right? If I'm asking you to do something, how do I make it as easy as possible for you to do that? So building that trust and that guidance sort of all wrapped up into one, I think is a big ask, but an important ask to build that trust and to maintain those relationships. So, as you just discussed the ways to really support patients through their health, through their illnesses, be it chronic or an acute event, you noted that there's a lot of different preferences, needs, desires, and that changes over time, over situations. So, when you think about the concept of patient engagement, which is certainly broad and nebulous, what does that, how do you see technology playing a role in improving that and making it meaningful for patients? And what strategies might you recommend to enhance their experience with a patient's experience with that?
Yeah, I think this is really an important consideration now, because all of us live our lives with, or many aspects of our lives, integrating with technology. We order food, we go to the airport, we order most everything that we get. It all happens through our phones and through our computers and through technology. And one of the places that we utilize technology the least, unfortunately, right now, is with healthcare. So I think, and the other thing that we see happening is more and more healthcare is moving into the home, and not as much, in the hospitals, in the doctor's offices, and so forth. So much more of that information and how a patient makes decisions about that is happening by themselves at home. So having really good tools to make those decisions is absolutely essential. So I think there's two or three things that patients need to do, and that health systems need to do, and that companies need to do, to make this work. From a patient standpoint, I think it's again kind of clearly defining, what is the solution you're trying to find, and then interacting with your healthcare providers to understand what kinds of resources they can help you with, right? Second of all is utilizing, many of the apps that are out there, and that's part of what we're working on at MDisrupt, is being able to eventually make kind of a public-facing searchable database to help to guide people a little bit along that line. So I think it's beginning to I'll say tiptoe into that technology to understand, better how to use it. From a company and a health system standpoint, I think it's utilizing the AI and some of the tremendous technology that's out there to, again, like we talked about earlier, solve a particular problem for a patient, right? To say, how do we utilize this to streamline this experience for that patient who's either undergoing surgery or undergoing rehabilitation or on management for chronic disease or whatever it is, that you use that technology to solve that problem for them. And it's a never-ending course. It's not like you ever get to that exact place, but always continuing to think about sort of the direction you're going and the bigger problem that you're trying to solve gets you closest to that kind of a solution.
Absolutely. Right. There's no end point or destination
There's no end point
to this journey, ever evolving. But certainly, as you said, keeping the problem or the challenge to solve at the center of it is a good tool to keep us all focused on what matters most, not only to the healthcare system as a whole, but certainly to our patients as well. So
An example that I've used, a couple of times, but I think really illustrates when technology is used well, is a few years ago when I was practicing. One of the other doctors that I worked with, she had a patient come in like on a Friday, who was very concerned, about a potential breast cancer. So of course she sent the patient right away. They had the evaluation done, right, and now it's the weekend, and now we're going to have to wait till Monday to see what the outcome of this is. But because of the newer technology, the result of the imaging became available in the patient portal, like, almost very quickly, almost that evening, right? The doctor saw that the result was there, so she contacted the patient to say, rather than waiting through the weekend, let's talk about what the results are. Get your husband. You're at home. Let's talk about the results are, right? So we don't have to wait an entire weekend worrying about what this outcome is. By helping to facilitate that relationship, that conversation, by enabling that interaction to happen more quickly, it very much helped to relieve all of the anxiety. It helped to build trust between the patient and the physician. And of course, it helped to get, really timely care. So I think when technology is used in ways that help to enable that relationship, when it helps to enable the information to the right people, it completely changes how healthcare is provided.
That's a perfect example. I used to laugh in a previous role that the most timely needs would come in on a Friday afternoon. And,
Yes.
inevitably it was like a holiday weekend. So Monday was
Mhm.
going to be closed as well. It was a large primary
Yeah.
care practice. And so when you said that as a Friday afternoon, and as a patient, as even, putting ourselves in those shoes, if you had to wait for that information, regardless of the outcome, that would be a very long and scary weekend. So that's a beautiful example of how, enabling that flow of information, and then, building that relationship, the provider taking that opportunity to assuage those concerns that patient would have really been struggling with throughout the weekend. So that's a great example. So I know we already talked about some of the things that some of these emerging technologies, right? More care within the home, things that the healthcare organizations could be leveraging in terms of AI on these large data sets. Of all of those possible things, and even some of the things I'm sure that you know pass across your desk and in your day to day and disrupt. What things excite you the most? What do you see that you say, oh, this is something that I think is going to have a really profound impact on shaping the future of healthcare or patient care?
Yeah. Well, we've kind of touched upon them, but to me, yeah, there's two really, really big areas that we're already seeing, begin to, I'll say, disrupt or evolve kind of care. The first, of course, we talked about is artificial intelligence, AI. That ability to aggregate and purposefully curate huge amounts of data and information, that has the potential to help not only with repetitive administrative tasks, but also with providing additional up-to-date information for the patient-centered encounter, by one patient at a time, like we talked about earlier. This will be, this is just my words, but in my opinion, artificial intelligence, I think, is actually kind of an outdated descriptor, because I think this technology, right, when curated and used appropriately, I believe it should be called aggregated intelligence that's used for augmented decision making. That artificial intelligence implies that this is something out in the vapors. It's not. This is information that exists that's being very quickly aggregated together and then presented to a patient or to a physician, a healthcare provider, to help to make some decisions about. It's a much different understanding than something out in the vapor making decisions, having intelligence, right? Um, so and especially as we're going into times when staffing and labor time, is creating really, really increased friction in being able to help to achieve that kind of value environment for improved outcomes at lower costs. At very least, digital and artificial intelligence solutions, I think, are going to play a huge piece in that, so that the clinical decision makers, at whatever they are, nurses, pharmacists, doctors, therapists, they can all have the ability to do what they do best, which is to have that relationship and make those decisions with the patient. And these other types of activities can be handled very, very efficiently in other manners. The second one we also talked about, which is this huge shift into care being provided at home. And it's happening at the entire continuum from health to illness, from prevention to management with medications. I mean, there's more medications now. I think I heard it not too long ago, there's something like over 700 medications that used to be by prescription that are now over the counter. Well, that means the patient has to make the decision about how to use this medication, those kinds of things. Of course, there's lots of rehab that happens at home, and there's even hospital at home, right? So more and more care across that whole continuum is shifting to home. And it kind of requires two major integrations and synchronizations, and also payment considerations, right? Because now you have both the episodic care facility, the hospital or the doctor's office, as well as the chronic care facility of the home, of perhaps the nursing facility, and the home care providers. There's so many more pieces of this. You talked earlier a little bit kind of about continuity of care. We used to think of continuity of care as kind of a single provider helping to care with the patient over a long period of time. But really, if you think about it, for most people now, first of all, the majority of our time is not spent in a healthcare facility. It's not spent in a hospital, not spent in a doctor's office. Most of our time, for even people who have chronic disease and complex disease, most of it is spent at home, right? And then they intersect with those other places from time to time. So the continuity of care is what that patient is experiencing at home, in the hospital, in the doctor's office, in the pharmacy, in the rehab. That's the continuity of care. Technology can help to integrate all of that information, can help to sew together so all of those people that are working with that single patient have vision into all of the things that are going on. To me, that's, again, a tremendous opportunity, first of all, to have patient-centered care. Second of all, to have a continuity of care, right? And third of all, so that everyone that's involved with that patient, including the patient, has all of the same information that they're dealing with. So those two things, the use of AI and what can be done with that, and trying to better integrate the care at home are two things that I see really, really going to impact healthcare over the next 15 years.
Absolutely. I think oftentimes even when you hear the idea of care at home, maybe that is sometimes synonymous with, maybe you just had a acute admission and now there's some care. But to your point, even those with chronic conditions, most of managing that is happening outside of any care facility, whether it is an acute care facility, a primary care facility, or any of those other important roles that you mentioned. And so being able to have that visibility and that shared information certainly would have a dramatic impact on not only the outcomes, but the experience, and not just the patient experience, the care experience. Everyone who goes into healthcare, it's fair to say that their desire is to positively impact their patients, right? And right. That is something that if you can have that communication really across all of those different settings, and it's easy to do so, and there's that degree of visibility, certainly that could only improve that fundamentally from some of the disparate systems that we all work within today. Yeah. I also do want to mention, I really like your distinction in the definition of AI. I think that's a really important, because words really do matter, and how people hear things. I think artificial intelligence can sound scary and sort of the unknown, but your point too, that you're really, I'm aggregating all of this information that does already exist regarding your care or care of people with conditions like yours. So I think that was very well said, and it could really help bring some ease around the concept of how to use a tool as powerful as that. So, as we wrap up today, I do want to just mention to all listeners that Dr. Robson's contact information will be shared in the show notes. So, he did mention early on how people could find him and the team at Disrupt. And so, that information will be available within the show notes. And if you have a great problem to solve or you're an expert, that's how you can find them. I would like to ask just one more question before we wrap up today's conversation. And that is, you've had really this very impressive career and continue to do this really important work. So what advice do you have for someone anywhere in the healthcare spectrum, whether they're maybe a newer clinician or they're an inspiring innovator, they're doing this work and they'd like to see it done different or better? What advice would you have for them to help guide them on that journey?
Sure. Thank you for that question. So I'll answer this in two ways. Partly, that's exactly what we're trying to achieve at MDisrupt, which is to provide advice and support to help companies achieve better patient outcomes, to help providers come in and be part of that. So that's the simple answer. But in general, I think that the most important step we've kind of already talked about, which is to start with the end in mind, right? As a clinician, you're wanting to innovate. As a technology company, you want to innovate. Start with what is the problem that you're trying to solve for that patient, right? And then work to find out what are all the factors that make it a problem. Not just the obvious ones, not just if they have problems with transportation, so let's solve transportation. That might be one of the problems, but there could be many, 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 many others, right? So look to find what all of the problems are, right? Then begin that wonderful process of iteration to say, let's try this solution, this solution, this solution, this solution, right? And let's see which are cost effective, and let's set up these, MVPs or whatever process you want to use to see, right, when we do this, does this begin to have an impact, and the reaction that we get from the consumer, right, from the patient, is this solving their problem, or is there a slightly different, better way to be able to solve it, so that you gradually fine tune it, right? Rely upon the expertise around you, right? From clinicians, from technology, from, all of the various people that you can draw upon to help to solve those things. And then, just keep moving forward. There's a tendency to try things 2 or 3 times and go, I don't think we're going to find the right thing. A lot of times you're kind of on the verge of finding a really, really good solution. Keep doing it. There are obviously important financial goals, social goals, career goals, and we all kind of struggle and work through those. But if you really keep focused on truly solving a real problem for a real patient, all of those other financial, social, career things all tend to fall into line, right? But you have to be very focused to make sure that you're solving a real problem and finding real solutions for that.
Perfect way to end our discussion today. I think that's really great advice in terms of staying the course, the iterative process, and all of those other factors that often do fall in line when we keep the focus on, really driving the outcomes for, the most important people in this equation, our patients. So thank you so much for all of the great insights that you shared with us today and for your time in today's discussion. I appreciate it, and I'm sure our listeners will as well. So thank you so much.
Great. Thank you, Lisa.
Thank you for listening to Happy Hour, Happy Patients. Please consider subscribing on your platform of choice and share your favorite episodes with other healthcare workers who need a bright spot in their day. You can connect with my team and me directly by going to providertech.com and clicking on Connect with Us. You can find the link to this in the show notes below. Have an awesome week.